Hi Rahil.
Hello, sir. How are you?
I'm good. How have you been?
I'm good, sir. Thank you so much.
So it's been almost 2018 or 19, I guess. You were part of academy, and even then we had this online
Yes,
interaction,
sir.
right?
Yeah, so I joined your academy in 2019, I
2019.
think in December 2019. Yes, so
Okay.
I graduated in October 2019 and then I started your academy in December 2019. Yes.
Okay. So first of all, Rahil, it's so good to see you directly after a long time, and I'm so
Likewise,
happy
sir.
for you. You initially
Thank you.
started your preparation towards NEET MDS, and then somehow,
Yes.
like you shifted to UK, and right now you're talking from London, right?
Uh, Actually from Norwich, it is 3.5 hours from London.
Okay, 3.5 hours. So, what is the time difference between your place and India right now? Is it 4.5 hours?
Yes, right now it's 4.5 hours, but from November onwards it will be 5.5 hours because of daylight saving thing which they
Yeah.
follow.
Daylight saving is applied, right? Okay, yeah. That's
Yes,
good.
sir.
So, first of all, Rahil, the intention behind these podcasts or sessions is because, as you know, like I have been traveling throughout extensively in the form of Freedom Tour, and then trying to, spread awareness regarding various career options that we have after dentistry, after BDS as well as MDS. So, since you have taken a relatively unconventional path, I wanted to highlight your journey and I wanted to hear from you so that the viewers or the students who are looking up to us, like, they will understand like what are the different options we have in UK for dentists. So I just wanted to hear your perspective on that. So first of all, how is life going on in UK?
Yeah, life is good, sir. It's fine as of now. Yes.
Okay. So like how long have you been in UK so far?
It's almost a year, actually more than a year. So I moved here in February 2023. On 14th of Feb, I moved here.
Okay.
And initially, I started as dental assistant, working as dental assistant, as well as I was in a course of dental assistant only. And right now, I'm practicing as dental therapist. So I get my registration in May 2023, and then I
Okay.
started practicing as dental therapist from August 2023.
Okay.
So it's been a while since I'm practicing as a dental therapist here.
Okay. So you started as a dental assistant and now you are a dental
Yes.
therapist. So for our,
Yes, sir.
for our understanding, can you just tell the difference between a dental assistant and a dental therapist? Like what would be the job role and what will be those differences?
Yes. So basically, dentistry in UK have a workforce team which are known as they are known as dental care professionals (DCP). In DCP, they have dentist who is the topmost of the workforce.
Of the
So workforce
pyramid,
leader,
yeah.
we can say them.
Yeah.
Then they have dental hygienist and dental therapist. Now, difference between dental hygienist and dental therapist is dental hygienist, they can only perform scaling and polishing and some of the perio things, which means non-surgical perio things like root planing and deep scaling, all that thing that can be performed by dental hygienist.
Yeah.
Dental therapist, on the other hand, along with scaling and polishing, they can also perform restorative treatments, which includes glass ionomer fillings, composite fillings,
Oh,
restorations of amalgam in adults as well as in pediatric patients.
okay.
And they can also perform extractions of deciduous teeth in
Oh,
pediatric patients, as well as if someone is having retained deciduous teeth for ortho purpose, if they want us to remove any retained canine or retained lower second molars, so we can do that as well. So
okay.
all along with that, dental therapists can also provide checkups. They can also do checkups in both adults and in pedo patients, and then they can refer their patients to the dentist if they think that they require an extraction or they require root canal treatment or they require any prosthetic work. So all these things are covered by the dental therapist.
Okay.
And they have then dental assistant. Dental assistant is same as we have in India, so they help dentist and dental
Yeah.
therapist and dental hygienist with their routine daily
They're not
work.
involved in any
They do have,
clinical procedures, right?
no, they don't involve in any clinical procedures, but yes, they there are certain courses. If they carry on or take that courses, then they can take radiographs, they can take
Okay.
impressions, and they can take intraoral photographs. So
Okay.
these things they can do, but for that they need to go for certain courses and then they're eligible to do that.
Okay.
After this three, there is another tag which is orthodontic therapist, which is also comes under the same dental care professionals.
Okay.
Now, orthodontic therapist is someone who specializes with brackets bonding and bending, so they can do that, but they needs to be work under the prescription of orthodontist,
Orthodontist.
definitely.
Yeah. Yeah.
Yeah. So, and yes, there is dental technicians as well, but that is a non-clinical thing, so they
Yeah.
work in
Completely
laboratories
non-clinical.
for fabricating dentures and
I
all
have
other
a doubt,
prosthetics.
Rahil. Yeah, thank you for the comprehensively giving us the details and differences. My doubt is like, see, suppose you're a dental therapist now. So, can you establish a dental clinic per se, or should it be done under the supervision of a dentist? How does it work?
So if I collaborate with a dentist, and then if I get a backup from a dentist, or if I have a full-time working dentist in my clinic or in my practice. So in UK they say it practice, they don't say it clinic. In India we say it a clinic, and in UK we say it practice, right? So whenever
Right.
I say practice, just think about it that I'm speaking about clinic. Okay. So if I have someone who is a full-time registered dentist, and if I want to open my own clinic, I can collaborate with that guy or that girl, and then both of us can start this venture and create our own practice. So that's a possible thing, but for that we
Collaborate.
need someone who is a full-time dentist who is working over there.
Okay, okay. So, like, so tell me, Rahil. So, I just want to know because there are, see, lakhs of students in India who are looking towards NEET MDS. Almost 25 to 26,000 students every year appearing for NEET MDS, and then we get into MDS, and then get into clinical practice or teaching. So, what was the reason that you had changed the course of your journey from India to UK? So, what was the reason
Yeah.
or the reasons?
So it's an interesting thing. So initially, that I started my preparation in December 2019. I joined your regular batch, your 12-month batch, right? Then preparation was going good as well, but lockdown happened, and then we all go back to our home. We have nothing to do, and at that point, one of my friends, she contacted me and she told me that, what are you doing nowadays? How is life and everything? So I mentioned that yes, I'm preparing for NEET MDS, and as we all are in lockdown, I'm doing nothing right now. I'm just doing my preparation.
Hmm.
So she suggested me that if you are doing your preparation, I will recommend you to think about an opportunity for going to for going abroad and doing higher studies over there as well. So I was like, okay, let me think about it. So when I contacted some seniors who are working already in US, in Canada, in UK, at that point they told me that yes, earning wise is definitely good here as compared to India, and competition in terms of dentistry, yeah, dentistry is competitive in India. So they told me that competition you will not face here when you come here.
Hmm.
So I was like, yeah, that's a good thing. Then I should pursue dentistry rather than going into a competition in which it is
Hmm.
quite difficult to establish yourself in such a competitive environment,
Hmm.
because I come from very decent family background, so I don't have much financial resources to support me after doing
Yeah.
my masters or after doing my undergrad. So I think that yeah, it's a better option if I want to go abroad and start my career over there.
Hmm.
So initially, I was planning for Canada because that's the easiest. And once lockdown came to a lit, so when we are in unlock procedure, unlock one happen, unlock two happen, and when they give permission to open your, means they give given permission to clinics that they can work now independently. So
Hmm.
I get a job opportunity in a different city. So I live in Ahmedabad, which is in a Gujarat. So I get an opportunity in Kutch, which is approximately 400 kilometers away from my city. So
Yeah.
I
Yeah.
shifted there. I started practicing dentistry over there. One thing was very clear in my mind at that point, that yeah, I want to go abroad and do something over there.
Hmm.
So I was practicing as well, but yeah, the only disadvantage which I find, when you go to Canada, right, you will get disconnected from the clinical part of dentistry at least for a
Hmm.
couple of years,
Hmm.
because you can't practice over there. You need to first clear their exams, or you need to go for university dentistry course in that country before joining the clinical workforce. So while practicing in that city, I was like, again, I came to the same question that should I go or should I not go? Because now I am literally at that point that practice were really good. There were lots and lots of patients. So I was seeing approximately 7 to 8 patients in a day. And on Saturdays and Sundays, when the owner of practice or clinic, when she used to visit us, we usually see 20 to 25 patients in a day on Saturdays and Sundays as well. So it was
Hmm.
really great. I was loving my job, getting good exposure, getting good clinical experience as well. So at that point, I think no, I want to do dentistry only. But by if I go to Canada, I will get disconnected from dentistry for 3 to 4 years. And I
Mm-hmm.
have seen that lots and lots of my my friends, my seniors, when they move to Canada after getting their course after, so for instance, they get into a non-clinical course, they completed their non-clinical course, and when they start their journey as working in that country, they never came back to dentistry. I don't know why, what's the reason behind that.
Mm-hmm.
Maybe each and every one of us have different reasons,
Yes.
but I have seen that most of them don't revert back to dentistry. They
Mm.
usually carry on with some non-clinical thing, and I
Yeah.
actually don't. So I am not looking into that. I was like, no, I want to pursue dentistry only. So at that point, one of my senior contacted me and he told me that there is a route by which you can come to UK, work
Mm.
as a dental assistant while
Mm.
studying.
Mm.
So it is a work visa, it is not a study visa. So I
Mm.
was like, yeah, that's a good option then, because the cost associated with both of that route is almost similar. Or I would say
Yeah.
it's
Yeah.
actually less for that work visa as compared to the
Mm.
student visa in Canada. Right. So I was like, yeah, this is a good option. So I should do that. And parallelly, one of my batchmate, so she get married and she came here and she
Mm.
applied for dental hygienist and therapist
Okay.
registration. So I was just watching some YouTube videos on dentistry and I got her interview. I was like, how is she directly applying for her dental hygienist and therapist? Because I have no clue about that back then.
Okay.
So then I contacted her, and even we were good friends, but after her marriage, we were not in that contact.
Mm.
So then after I contacted her, so her name is Farana. Then after I contacted her and I asked Farana that how do you get into this dental hygienist and therapist registration process?
Mm.
So she explained me that there is an academy who help with all this thing.
Okay.
So I was
Mm.
like, yeah, it's a good thing. And as I am planning to come to UK working as a dental assistant, it's a good
Mm.
thing if I start work as a dental therapist as well. So I applied for that route as well
Mm.
in at that point. So
Okay.
this is how I came to UK initially as a dental assistant, work here as a dental
And
assistant
then
for
the
few months,
therapist. Yeah.
and then I got my registration as dental therapist, and then I started working as dental therapist.
Okay.
And the thing which I would like to mention here is, so thanks to you as well, because as soon as I come here, you provided me the contact of Dr. Chandrika Avaru,
Dr.
right?
Chandrika, we should thank Dr.
Yeah.
Chandrika. Yes, yes. She was
Yeah.
kind
And
enough
then when I
to.
contacted her while I was going through this dental assistant process, because to be honest, initially I don't like being a dental assistant because it's a non-clinical work and we
Yeah.
don't have much to do and it's a hectic job. So I contacted her. So she told me that once you get your registration, contact me because I have a position of
Mm.
working as a dental therapist. So I can offer you that. But for dental assistant, it will be same. If you work here with me or if you work here where you are working, it will be one or the same. So I
Yeah.
was like, okay. So when I get my registration, I contacted her and then she provided me this opportunity. So ultimately, I'm very much thankful to you as well that you provided me her contact detail, and by
No,
you,
I'm
I
just a
came to know
mediator,
her.
Rahil. I want to
So
highlight this for the sake of our viewers also. Right from beginning, I've seen you like from the day you joined academy and then preparing for entrance way back. Then I've seen how hardworking you were, how consistently you're putting effort. So the point is, it's all about it's all about here, like if we are willing to work hard in a dedicated manner, in a consistent manner, universe conspires in our favor. So all of us are
yeah,
just mediators, but ultimately it's your efforts which have put you in a position where you are today. So that's why I'm genuinely happy for you, and whenever I think of you, I get those positive vibes, and that's one of the reasons why when I was in Gujarat, I even met your family and had an
yes.
amazing time with them. So briefly, just give us an idea, Rahil. So right now you are working as a dental therapist, right? You're registered there. So are you
Yeah.
planning for ORE? How is it going on? Like those are planning for ORE, what would be your suggestion in brief?
So ORE is Overseas Registration Examination is a two-part exam, part one and part two. They do have another examination that is LDS. Now LDS is conducted by Royal Surgeon College, England, and ORE is conducted by GDC itself, that is
Okay.
Government
Mm.
Dental Council of
Yes.
UK.
Yeah.
So government and General Dental Council,
General
not
Dental
government,
Council.
sorry. Yeah. So General Dental Council of UK conducts ORE. They conduct usually 2 times in a year, right? Part one and part two. Part one is theoretical part and part two is a practical part. Now the percentage of passing ratio in part 1 is little bit higher as compared to part 2. So part 1 percentage right now is somewhere between 65 to 75. So on an average it is 68. And for part 2 it is somewhere between 35 to 45. So on an average 38, somewhere like that. Okay.
Mm.
And getting into ORE is not that difficult. First, you need to prepare your documents very good,
Mm.
and then you need to apply in the General Dental Council, and they will assess your documents. But once you get yourself on the waiting list, finding a slot for the examination is tough because thousands of students are applying for the
Yeah,
exams,
yeah. You
and they have
mentioned that
limited seats
previously
every
also.
year.
Yes.
And right now, as most Yes. And right now, as most of the students, actually Indian dental graduates, as they are migrating towards UK, they have numerous amounts of backlog. So for instance, I have given my application to assess, and initially they told me that there is some issues with my name in my passport and in my degree. The name were not correlating with each other, and that's why they want me to resubmit the whole application thing. And now I'm planning to do that. But what I will suggest to your viewers is try to apply as early as possible, because the friend which I was mentioning, Dr. Farhana, she applied before me, and she had waited, I think so, for 1.5 to 2 years before getting any reply from the General Dental Council.
Oh my God.
So the workload they are having right now and the shortage of staff they are having, because of that the backlogs are massive. So you need to wait and be patient when you listen anything from them. And even after getting a reply, if they think that there is a tiny bit of error in your application, they will reject the whole application, and you need to do it from
Oh my
zero.
God. Oh my God.
Yeah.
I
So
mean, it sounds very discouraging, but at the same time, as you said, in the meantime, in the waiting time, we can go ahead with these courses, or or do a search for some part-time jobs or gain some
yeah,
experience as you have been
yeah,
doing. And in a way, it reflects your passion towards dentistry. As you rightly said, Rahil, those who get deviated, they want to pursue dentistry in US, UK, Canada, and they try to choose some other courses, and the line shifts completely because ultimately finances are a matter of concern, and once we find financial satisfaction in something else, we usually don't get back to our roots. So now coming to finances, I was told by Dr. Chandrika, who is working as a dentist there, that the earning potential of dentists is really good. What about the earning potential of dental hygienists or dental assistants? How is it? Like, can we take care of our expenses? Like, is it lucrative? That's my question. So, what would be your answer?
yeah. So in terms of earning, definitely earning potential is very good. Even if you're working as a dental assistant, then also you will be earning more than a recent BDS graduate in India, right?
Yes.
So if you are a single, and if you live on your own, you don't have a family here, then definitely you can live well even as a dental assistant. But
Okay.
if you are a married couple, and if your partner is not working and you are the sole bread earner of
Hmm.
the family, then dental assistant salary will going to help you, but it will not going to help you in a good way, so you will not
Got
able to
it.
save anything.
Got it.
But as a dental hygienist and a dental therapist, yes, the earning potential is really good. If
Okay.
you are in a good place, if you are in a good practice, if you are in a position where you are seeing at least 20 patients in a day,
Hmm.
25 patients in a day, then definitely you will going to earn. Now
Great.
earning depends on two things. So they have two types of employment here in dentistry. Employment one is full-time employee, in which you will get hourly wage. So for instance, they have different types of hourly wage. Some of them are giving 20 pounds per hour, some of them are giving 30 pounds per hour, depending upon your experience and your expertise.
Yeah.
The other part is self-employed part, in which you will earn based on the number of patients, based on the number of
Got
checkups
it.
or treatments that you do.
Yeah.
So
Yeah.
right now I'm working as a self-employed. So it completely depends on my skills and on my
It's
potential, that
proportional
how
to
many
your
number
skills
of
and
patients
the
I
time
am
you give.
seeing in
Yeah.
a day,
Hmm.
and based on that they are providing me my earnings. So these are the two different aspects. But yeah, if you are a dental hygienist or a dental therapist, then definitely you will going to earn good
Okay.
in UK, and you can also take care of expenses of your own. And you can also, if you are living alone, then you can take care of expenses, and you can also save good amount of money and send it back home if you want to. So
Yeah.
that
Yeah.
can be done as well.
That's nice. So, like, before we conclude, I have just a couple of questions, Rahil. Like, you've been in UK for a couple of years now. So when you compare yourself, like you're from Gujarat, right? You're
Yes.
properly from Gujarat. So when you compare the lifestyle, the income, the status of living, so how does it feel?
So when we compare, so like it depends upon what criteria we are comparing, right? So for instance, if we are comparing it on a criteria of finances or economics, then definitely earning potential is very much good here.
Yeah.
Now,
What about the
initially,
lifestyle? I'm really interested in knowing that lifestyle.
okay. So lifestyle is, it has its own benefits and benefits as well, and some disadvantages as well. So like here, when you earn, you can do multiple activities if you want to. So for instance, if you are good at playing chess, or if you are good at listening to music and you want to join a band, right? Now here, dentistry also works just like a corporate thing. So for instance, in India, we have clinics, so we need to go in the morning and then we usually come at night, and we don't
Exactly.
have time to do what we want to do actually,
Yes.
right? And here we have same like 9 to 5 job. Okay, so after 5 we can do whatever we want to. If we want to go and play some sport, we can do that. If we want to read a book, or if we want to improvise on a certain skill, we can do that.
Mm.
And we get Saturday Sunday off, so in that time also, if we want to do something, we can do that. So in that way it is a good thing. But the negative side of UK is it is not that socially happy country or a good country.
Mm.
Yeah, definitely, if you have a family, if you have friends, if you have someone you know
That
who
would
live
be
here, then
different.
it's a good
Yeah.
thing.
Yeah.
Yeah,
Mm.
then the scenario will be completely different for you. But
Yes.
if you are
Indeed.
completely a new candidate, if you don't know anyone, if you are on your own, then that side is a little bit more dark, because you don't have someone to talk to when you come home. And when you come from a country like India, where we socialize a lot, where we have multiple friends, multiple relatives, multiple
True.
family members to talk to
Yeah.
to share what our day was like, and to ask them how they were all day and everything like that. It's not possible in UK because of time difference, number one,
Mm.
and people are very much busy in their own
Everyone is
life.
busy in their own stuff. Yeah.
And as the living standard is good, you have to earn more to cope up with that living standard. So for instance, if there are 4 members in a
Maintenance.
family,
Yes.
kids, a husband and a wife, in order to sustain that family, run that family smoothly, both husband and wife have to work. Because if they don't work, they won't be able to take care of all the bills, because
They cannot
rent
pay
is
their bills. Yeah.
expensive,
Agreed.
even if you own a house that expensive. So these are the negative sides of
Flip
being in
side.
the UK as compared to India. So on one side, you will get more time for yourself, definitely, because after 9 to 5, after 5 o'clock, you are free, you can do whatever you want to.
Mm.
But on the other side, the social aspects, all these things, family related aspects, friends related aspect, they are missing in my opinion. So these are my experiences. I might be wrong.
No, but that's
Some other
your,
guy might
yeah,
have
yeah.
different
There's nothing like
experience.
right or wrong. It's your experience, right? Your experience is unique in its own way. Yeah. It's your
Yeah, so
perspective.
these are my experiences.
Yeah. Yeah. So finally, before we conclude, Rahil, like, so when are you coming back to India? Or are you coming back or not?
So my right now my long term goal is not to settle in the UK, but
Mhm.
I'll see how it goes basically.
Yeah.
But even if I want to come back to India, as I have mentioned that I am coming from very decent family background. So first I need to make sure that I earn a good amount of money,
Yeah.
because earning potential is good, number one. And when you
Don't worry, your
convert
sister
one
is there.
pound,
Your sister is also an MBBS doctor. She's also
yeah,
going to
I
earn
know
very
she's
well. Rosina, right?
yeah, yeah,
Yeah, I
yeah,
remember the name
Rosina.
Rosina. Yeah. She's also going to
Yeah,
earn very well.
yeah, she is there. So she is right now preparing for masters only. She's
Yeah.
preparing for her
Need
NEET,
PG.
which is in 23rd of June. So she is preparing for that.
Yeah.
So yeah,
Yeah.
she is there. But right now I'm a bit skeptical whether I'm going to continue here or not. But yeah, I'm looking forward to it. We'll see how it goes. But
Okay.
yeah, so first I need to make sure that I get that financial stability before making any
I understand.
further decision.
Yeah.
So yeah, as I have mentioned, that earning potential is really good. So if you are someone who wants to earn a decent amount of money, and yes, one thing which I would like to mention to your viewers is, don't fall in trap for non-clinical courses if you don't have much financial backup, because non-clinical courses will cost you somewhere between 20 lakhs Indian rupees. Okay,
Mm.
15 to 20 lakhs. After getting into course, you will think that yes, after, so how student visa works in the UK is, you will get a student visa for 1 year, and later on you will get 2 year post study work permit. So in and all you will have 3 years.
Yeah.
For the first year, you are allowed to work only 20 hours in a week.
Yeah.
In that term, you can able to take care of your expenses while living in the UK. But you won't be able to save anything, because many of my friends are working in the UK and they are on student visa right now. So I know what the situation is like. After completing that course, all that non-clinical course, they say that they are on shortage occupation list, but getting a job is very difficult. I'm not
Exactly.
saying that you'll not able to get a job, but yeah, it is very difficult. I haven't seen any of my friend getting a job in their own field after completing a non-clinical course from the UK.
So in that
So
case,
they are
what they
doing
do
the
is they
odd
take up
jobs.
some odd jobs and then they somehow survive,
Exactly.
right? Yeah. Yeah.
Yes. So after completing their course, they take up odd jobs. So they work as a cashier
Got it.
in
Got it.
any of the, yeah, in any of the departmental store, or they do all such kind of job just to earn money and to
Yeah.
save, because they have invested 20 lakhs, right?
Yes. Yes.
Now after 2 years, UK will not provide you any kind of long-term residency. So they don't have long-term residency route on the basis of student visa. If you want to get a long-term residency, if you're thinking to live here and settle here, you need to get a tier 2 sponsorship. And for tier 2 sponsorship, you need to have a tier 2 sponsor job.
Okay.
And that non-clinical courses will not going to help any of the student to find a tier 2 sponsored job, because there are multiple thousands of students who are coming every year on the same course, right? So they will spend more money, and they will not going to get a sponsored job. Well, even if they are lucky, then definitely exceptions are always there, they can get some jobs,
There
but
can be
it's very
exceptions. That's
tricky thing.
true. Yeah.
Some may get, some may not get, right? So that courses are, in my opinion, that courses are not a good way to look forward if you are coming from a decent family background just like me, and if you are thinking that yes, after spending 20 lakhs we are going to earn more after coming to UK on the basis of that course. So on the basis of that course, I am not sure how well you will going to do after completion of that course. And the other thing that I would like to mention is, now this dental hygienist and therapist route, unfortunately, the General Dental Council of the UK, they have closed this route last year only.
Yeah. You
So
mentioned
now,
that.
if you are an Indian graduate who has completed BDS, you will not able to enroll in this dental hygienist and therapist thing. So you have just two options. Either you can come here and work as a dental assistant, and while working, you can start preparing for your ORE and give your oral
Mm,
overseas
mm,
registration examination and get yourself registered directly as a dentist, which is definitely a good thing.
yeah.
Or second thing is, prepare for ORE and come here just to give ORE, clear ORE, and then you will find a spot, because right now there is genuinely shortage of dentists who are working under NHS. NHS is National Health Scheme, which means a
Yeah.
government scheme in which they provide primary dental care treatment to government patients. So there is definitely a shortage of a government dentist here. So if you're looking forward to work as a dentist, just prepare for ORE, complete your ORE, and then come here as a dentist only. Or if you want to earn and you want to save money as well, come here as a dental assistant, work as a dental assistant. You can save a decent amount of money as a dental assistant as well. It's not like you will not able to save anything, definitely you will going to save, but
Mm,
means if you're working only as a dental assistant, you won't be able to support your family
true.
here. Well, definitely you can support your family back home, because when you send money, even if you send 200 pounds, it will going to convert into 20,000, so that's a decent amount of money.
Yes.
But if you are here with your family, just working as a dental assistant and taking care
It
of
will
your
not be of
family
much. Yeah.
will not be possible,
No.
right? So that's the thing. So that's the whole scenario, because some of your students also contact me. So whenever when you went to different colleges, you have
Yeah. Yeah.
provided
I
me
did
my
give
contact
your
details to
contact.
many of your students,
Yes.
right?
Yes.
So they contact me and they told me that they always want to know which course is best to select, which course is best to come here. So with your help and with this YouTube medium, I would like to say that you can take any course, whether you want to be on the non-clinical side, you can take the course, will not going to help you to get a job. So just make sure that keep that thing very much clear in your mind,
Yeah.
that that course will not be much helpful to find a job.
Yeah.
So that's the whole thing.
Thank you, Rahil. In fact, you answered my next question. That is, what would be your message to all the aspirants? Because in the process of this tour, where I've been to several colleges, whenever someone asks me about UK, I have to give your WhatsApp number. But we'll do one thing. We'll forward your. I mean, if you're willing, then I'll give your
Sure.
email ID so that they can reach out to
Yes.
you through email, and then, if possible, try helping out because we need genuine guidance. That's what
Sure,
matters.
sure.
And
Yeah,
thank you so much, Rahil.
you can mention my WhatsApp number as well if you want to. That's fine. But the only thing is I won't be able to answer all the questions in one go because of time difference. So
Yes.
I'll try to answer as soon as possible. But definitely I'll going to
We'll do
answer.
it through mail, Rahil, because that would be, even I follow the same protocol in the
Sure,
sense, because on WhatsApp it goes on and on. It's not that convenient. Also, we'll ask anyone who
sure.
is really interested to get back through mail in a single shot, and you can have that standardized conversation over mail. And thank you so much,
Sure.
Rahil, for helping out.
You're
Because in
most
the process
welcome.
of this tour, I gave your contact to many people, and I'm sure
Yes,
I
yes,
know
yes,
that you've reached out to everyone because I do get feedback from my
yes,
students, and you've been very kind. And
yes.
may you achieve all that you dream and bring
Thank
your
you so much,
family
sir.
out of that zone. And I'm sure you'll be successful, because I believe in this. If our intent is pure and if our actions are aligned with our intent, the entire universe will
Thank you
conspire
so
in
much,
our
sir.
favor. So all the very best,
Yes.
and it's amazing interacting with you, and let's keep in touch. Thank you.
Sure, sir. Thank you. Yeah, thank you, sir.